19th of January 2022.
Surging COVID cases are putting extra strain on Victoria's weary ambulance service.
Paramedics and the call centre swamped by potential COVID patients.
From news.com.au.
I'm Andrew Bucklow, and I've got news for you. Well, to say that Australia's healthcare system is under the pump at the moment would be a massive understatement. High COVID case numbers across the country, plus staff shortages due to isolation, have placed a huge strain on our hospitals. And those feeling the strain the most at the moment are actually paramedics. They're the ones who not only respond to COVID calls, but also all other emergency calls like car crashes and heart attacks. Today, we're going to meet a paramedic from Sydney who says the last 2 weeks have been so bad that he's seriously considered quitting.
I just don't know anymore that it's worth the sacrifices to our own sort of physical and mental well-being to stay as a paramedic in New South Wales anymore.
Now, I promise it's not all going to be doom and gloom, okay? The paramedic is going to share some of the more amusing stories from his career, and he's also going to answer a question that I've always had. What happens if they're in an ambulance on the way to a job and then there's a car crash right in front of them? Do they stay and help the people at the car crash, or do they keep going to their original job? Joining me now is Brett. He's a paramedic with the Australian Paramedics Association, and he's been an emergency responder in New South Wales for 13 years. Brett, firstly, I imagine it's been a pretty stressful time lately. How are you doing?
Yeah, right. It has been a stressful time, and we're not doing too bad. We are definitely struggling a lot at the moment out on road, but we've got exceptional networks amongst our own sort of paramedic workforce, so we're taking care of each other as best we can.
All right, let's talk about this bloody pandemic. Omicron is sweeping its way across the country at the moment. That means there's unprecedented demand for ambulances, plus hundreds of paramedics have been sidelined due to having to isolate themselves. Just how bad are things at the moment?
Look, they're pretty dire. We were sort of hoping that, we're now into our third wave of this COVID pandemic in New South Wales, and we were hoping that lessons might have been learnt from the previous two waves, but it really seems like they haven't been. We are absolutely chronically short-staffed. We've got huge amounts of staff in isolation, but a lot of these are not brand new problems for New South Wales Ambulance. It's just something that's been highlighted that we've been suffering through really for the last 10 years as far as, staffing and that type of thing goes. But it's pretty horrific out there at the moment.
So given it's so horrific, what's the morale like amongst you and your co-workers? Do you just dread going to work every day at the moment?
Yeah, we do actually. I mean, obviously I can't speak for every paramedic across New South Wales, but really the last 2 weeks have been, personally for me, it's been really, really tough. And it's probably the first time in my 13-year career where I've legitimately stopped myself and thought, there has to be something else I can do. What other skills do I have? What can I go and retrain in? Because I just don't know anymore that it's worth the sacrifices to our own sort of physical and mental well-being to stay as a paramedic in New South Wales anymore. And that was a real sort of watershed moment personally for me, because that's the first time that's happened in 13 years.
What is it that's so bad at the moment in the last couple of weeks? Is it just the number of cases? Is it the treatment you're getting from people on the streets? What is it?
Look, it's the sheer call volume at the moment is absolutely killing us. We've seen sort of around the start of January and in the first week of January, our average 7-day call volume was over 4,500 cases a day. And that is absolutely unheard of. We were we're prepared to handle, maybe 3,000 calls a day, and 3,000 calls a day would be a big ask. Even, 6 months ago, that would have been a big ask. But to now be, averaging 4,500 and even 5,000 on some days, it's just unrelenting. It is just constant, and the fatigue and the burnout amongst the crews is something that's really concerning at the moment.
So many people are catching COVID at the moment, and it's probably scary for a lot of people. They freak out when they have the virus. But are you finding that a lot of people are calling for medical assistance when they've just got mild symptoms and they probably don't actually need an ambulance?
Yeah, certainly. A lot of the COVID calls that we are receiving at the moment are from otherwise fit, healthy, double vaccinated people that are really just concerned about their symptoms and are really unsure of what their actual disease process will be and at what point they should be seeking that sort of escalated level of care. For the majority of people, managing at home with, your Panadol and hydration and that type of thing is what a lot of people will need. It'll suck. Don't get me wrong. It's going to be 7 days of feeling really, really shitty. But a lot of people can manage their symptoms at home. What we're finding is we are getting called specifically to people with COVID that are concerned. But because it's now also so widespread in the community, we're turning up to people complaining of chest pain or have had accidents, broken bones and that type of thing. And they also happen to have COVID. So it just adds this whole nother layer of complexity around jobs and around cases for us.
We've seen reports that wait times for ambulances have blown out in recent times under the strain of the pandemic. I'm wondering that with patients who do have to wait a long time for you guys to rock up, when you do rock up, do they have a crack at you or are they just appreciative that you came at all?
I would be lying if I said that everyone was being, chilled and polite and respectful. We are seeing, some members of the community who are, lashing out at road staff when they do turn up. But really for us, that's just part and parcel of our job now. If someone's sitting at home with chest pain, panicking that they're having a heart attack or something like that, and it takes 90 minutes for an ambulance to turn up, they're understandably going to be very stressed, very anxious, and afraid, genuine fear. We are sort of on the back foot a little bit when we are turning up to these patients, but we are exceptionally skilled at de-escalating situations and bringing calm to chaos. So, we are able to sort of eventually bring these people around. But I would have to say, 95% of people are very understanding when we do arrive.
Brett, something that we're seeing right around Australia at the moment is ambulance ramping. Now, for those who might not be aware what it is, can you just explain it to us?
Yeah, so ramping is when ambulances are physically stuck outside emergency departments with patients in the back of their vehicles and they're unable to offload them into a health facility. And that's because there simply either isn't enough room in the emergency department or enough treatment spaces for them. And then it's basically a backflow problem right through the hospital. So if you've got 200 beds in a hospital and 198 of them are occupied, then there's very little opportunity for emergency department patients that need to be admitted to move through that health system. So we unfortunately, at the very back end of that process, are left waiting outside emergency departments or in corridors and that type of thing. And let me tell you, as temperatures warm up and humidity increases, waiting outside an emergency department for 2 or 3 hours with a COVID patient in full thickness plastic PPE is absolute torture some days.
I can imagine that must be incredibly frustrating for both you and the patients.
Yeah, and a lot of the patients don't understand what's going on, so you're again having to sort of apologise and explain the pressures on the health system and that type of thing. And genuinely, I would say probably the majority of our patients do genuinely need to be there in the emergency department. So it's not like you can just sort of say, all right, well, you've waited on the stretcher for 2 hours. You may as well just go home. We can't do that. So, it's often left up to paramedics and then nurses trying to help us manage our patients as well. They are absolutely slammed and rushed off their feet at the moment. So we're all sort of trying to pick each other up and, pick up the slack from, different departments in the system. But, it's difficult.
All right, let's move away from COVID for a bit now, Brett. I have a couple of stupid questions that I've always wondered about paramedics.
Amazing. Yep.
The first one, what happens if you're in an ambulance on the way to a job and there's a car accident that happens right in front of you? What is the protocol? Do you keep going to the original job that you've been assigned to, or do you stop and help the car accident?
We will always stop and help at that car accident. And this is a scenario that a majority of paramedics will have faced in their career, based purely on the nature of, emergency driving and that type of thing. If there are injured people, we will stop and wait, and we will treat and assist those patients, and they'll reallocate another ambulance to our original job. If there's no one injured and that's not an ambulance appropriate case, then we'll notify our control centre and we'll continue on to our original call.
There we go. All right, another question I have. Whenever I watch ambulance shows on TV, I always notice that regardless of how serious the incident is, when paramedics rock up to the job, they always seem to just walk in a very calm, slow manner from the ambulance to the patient. Now, is that deliberate?
Absolutely it is. Very rarely, if ever, you will ever see a paramedic running to a job or anything like that. And there is science behind it. That type of activity raises heart rates, raises adrenaline, all that type of thing. So forcing yourself to walk slowly, calmly to a job and, using your own breathing techniques and that type of thing keeps you calm as anything. Like we often say it's like watching a duck swimming across a pond or something like that. On the surface, seamless, doesn't seem to be moving, but then under the water you can see those little feet kicking, and that's what we do on basically on every job.
What are your favourite types of jobs to attend as a paramedic?
My favourite types of jobs, look, I've got a real sort of soft spot for the oldies, they are genuinely some of the most, warranted calls that we get, people fallen or, they've often got very complex health needs and that type of thing as well. And a lot of elderly people you find do live on their own because their spouse might have passed away or something like that, and they don't often have a lot of contact with the community. So, I really like taking care of the oldies, taking the time to sort of just slow it down and have a bit of a chat and ask them about their life and that type of thing. And they get a real kick out of it as well, even though they might be feeling, absolutely rubbish because of whatever's happened to them.
Brett, you've been a paramedic for more than a decade. I'm sure you've got plenty of amazing stories, but if you had to narrow it down to just one, what's the best story from your career?
Oh, my absolute best story. Look, everyone always gets a kick out of delivering babies and that type of thing. Definitely had a few sort of hairy ones on the side of roadsides and that type of thing. It's hard to sort of pinpoint one, like they're all rewarding in their own way, which I know is a bit of a cop-out answer, but trying to think of one specific one's probably a bit too hard.
Has anyone ever named their baby after you because you helped deliver it?
No, definitely. I would hope not. I would hope not.
Especially if it's a girl.
That's a lot of pressure.
Okay, you must also get called out to a lot of embarrassing injuries. Can you tell us about some of those without naming names, of course?
Something that we go to quite a lot of is, people might have bad backs and that type of thing, and they've seized up and slipped over in the shower on the bathroom floor or that type of thing. So, you always get the call out, oh, I'm in here, sorry, I'm nude or something. Like, oh, God, we've seen it all before. You just walk in with a sheet and throw it on top of them,
Okay, on the flip side, as a first responder, I'm sure that you've seen some pretty shocking sights as part of your job. What are the most confronting kind of incidents that you get called out to?
I think a lot of the confronting stuff is, obviously very violent scenes, sometimes car accidents or accidents involving people on farms and that type of thing. They're always really, they can be quite difficult to deal with. Luckily we've sort of come leaps and bounds in our sort of debriefing strategies and how we deal with and talk about mental health as a workforce. When I started, if you were to put your hand up and say that you had a problem or you weren't coping or something like that, it was something you just didn't do it. Whereas now we've sort of thankfully come full circle, and it's almost the exact opposite, that, it's now frowned upon if you don't almost put your hand up and say that you're struggling, because we've all been there and we've all experienced it, and, we're all there to sort of help each other and get through basically what is a day-to-day experience for us, So, I'm glad that that's the sort of culture that we have now amongst ourselves as a workforce.
I know you said at the top of this interview that you were starting to have doubts about whether you wanted to remain a paramedic. How long do you think you'll keep going?
Look, if things keep going the way they go, I can't envisage it's going to be too much longer. It is a great job for all the negatives that we do have to sort of tolerate and put up with. It is a great job being able to go out there and serve your community and that type of thing. It certainly does give you a sense of pride that people do sort of have that respect for the job that we do. I would like to think it's a long-term career. I would like to think that. But not wanting to put a downer on it. If it continues the way that we are continuing, and not just the workload, like paramedics have copped it from the government for a long time now, and it does make it really difficult to sort of front up to work and keep going. But I hope to be around for a little while yet.
Well, we hope to have you around for a long time as well. Brett, thank you for all the work you do, and thanks for chatting to I've Got News for You.
Great. Thanks so much, mate. Take care.
That's all we've got time for in today's episode of I've Got News for You. Thank you so much for listening. And just a reminder, if you do need an ambulance at some stage in the future, be nice to them, okay? They are absolute bloody heroes, and we are lucky to have them. I'll catch you later.